knowledge on the clinical aspects of a Zika congenital syndrome and its impacts on children in order to support better public health policies. It is a work that crosses data from different information systems in Brazil, such as mortality, born alive, social programs, and we integrate this data with information on social and health behaviors, such as SINASC, the nutritional and food system, mortality system, hospital admission systems, the single registry I've mentioned, I believe, BPC. The integration of such data in longitudinal structures allow us to answer research questions on what has happened and what is happening to children born starting in 2015 up to 2017, when we had the greatest incidence of Zika syndrome. The webinar also counts on the participation of partners such as the SVSA, the Federal University of Bahia, Hygiene and Tropical Medicine students, University of Pernambuco, University of Brasilia, representatives of the Pan American Health Organization, and Unizika. We will discuss the several elements that will allow us to go forward with an open dialogue that will help us finding solutions to the challenges. You can forward your questions through the chat tab, and we will have the opportunity to discuss those with our guests. This webinar is also being transmitted through the CIDACS Fiocruz Bahia YouTube channel. Offenses and respectful comments will lead to the removal of participants. We will start with the introduction of guests, and after the presentations, we'll have some time for Q&A. I'd like to invite Professor Mauricio Barreto, professor at the Federal University of Bahia, scientific coordinator and founder of CIDACS. You have the floor, Professor Barreto. I believe Betania has already given the necessary introduction. I'd only like to ratify that we gathering this important group of speakers with great joy to once again address the Zika issue. It is a great pleasure to see here individuals who were fundamental to the creation of a Zika platform. Arjen War, who was the Minister of Health when the Zika epidemic, when we had the outbreak of it, and some other colleagues such as Selena and Ricardo, who was here shortly ago. I'm not sure he is still here, but they were fundamental in developing knowledge on Zika fever. They from our neighboring state, Pernambuco, and other leaderships who were also who have also joined us here this morning. Individuals who are contributing to increasing our knowledge on Zika. We from CIDACS, and I will try to explain in further details during my talk, we tried to combine nearly as a permanent activity, given the commitment that we undertook in our group to keep the necessary efforts to understand such a complex problem, which was our Zika outbreak. But before the Zika outbreak, we had the COVID-19 pandemic. We were caught by surprise. COVID, of course, will be a much bigger thing, but the Zika epidemic also brought some concerns and opportunities for us working with the public health, because we're supposed to think the health of the population as well as moral and ethical issues involved in the approach that we wish to have, and no doubt that it also opens possibilities for us to think about everything we are engaged in, which is, science of epidemics and science of Zika specifically, as well as our approaches and interventions. We have here with us the surveillance department, division of surveillance of the Ministry of Health, and those were very important, those departments in the specific states. And it's good to have Olivia with us today, uh, talking about the developments in the specific division uh, for it. And now I thank you all for your participation, and we should understand this as an additional effort. It is a celebration, of course, but it is also a milestone so that we will never forget what has happened 10 years ago, and it still bothers, and it still has its consequences and impact on children and families affected by the epidemic. And then I will now give the floor back to Betania to begin our webinar. Thank you, Professor Mauricio. We will now start with the first panel on the perspective on addressing the Zika epidemic in Brazil, Latin America, and in the Caribbean, lessons learned and current situation. We have a representative of the Pan American Health Organization with us, Luciana Reis, President of Unizika Brazil, national organization devoted to developing public policies aiming at families affected by Zika, also the surveillance of arboviruses, and representative of the Division for Health Surveillance, SVSA, Dr. Martelli, senior researcher, coordinator of a microcephaly group, full member of the Brazilian Science Academy, José Agenor Alves, senior advisor to Fiocruz, Professor Annie Cruz, an associated CIDACS professor, full professor of the London School of Health and Tropical Medicine. Thank you, Betania. It is a pleasure for me to be here in this first panel, sharing this with those who can contribute a lot to the developments. I'd like to welcome those who joined us, particularly the participants of the panel. And without any further ado, I'd like to give the floor to Dr. Ildo. First of all, good morning, everyone. I'd like to thank for the invitation, from Dr. Morales from the Pan American Health Organization. And please make sure you can actually see my slides on your screen. Yes, we can see it, although no in full screen. Now, yes, we can. Thank you very much. So let's keep going then. Well, very quickly, I'm sure that you are all aware of it, but Zika virus is particularly transmitted by the Aedes aegypti mosquito. But look to the right-hand side. These are other ways to transmit Zika. Vertical transmission, sexual transmission, and transfusional transmission are also very important in the mode of transmission. History of infection, very quickly. I'd like to call your attention to the very first identification in 1947 in Micronesia, where we realized this was a very important epidemic. It was one infection, one wave, but what is important here as well is to call our attention to what happens in May 2015, and many of the authorities who experienced it are here, but we identified this event both in Chile and Brazil. It was very important to identify and treat one of the very first public health emergency after the context of the international sanitary regulatory framework. I'd like to let you know that all data I'm going to show you are from the PLISA platform used to share information, and this is where countries have agreed or will agree on the data that will be shared by them with all America's countries. And I'd like to briefly show you because it matches the early remarks by Professor Mauricio and Betania. What happened between 16 and 17? It shows an important historical series given the magnitude of the infection in 2016. And then Brazil, given its huge size and geographic position, and the introduction of the infection was part of this large curve in the left, 2016, as you can tell. At the same time, it is important to tell you that at first we still had many susceptible, but still have 20,000 cases confirmed 2025. No, we didn't even finish the year yet, but it's important to call our attention to the successive cohorts that are accumulating year after year. We have to understand also possible future prospects which may lead to another a surge, not such as it happened in the past, but in the future we will certainly have generations getting pregnant that would worsen the situation. This is a very briefly explanation of the distribution of cases year after year. This is cumulative year after year, and of course, Brazil is still adding to the incidence of the disease. I understand this is an important information and it calls our attention given the size of the country. I'd like to leave you with this message, although I will address it again later on. It has to do with the historical series. Zika virus is not alone. We also have chikungunya, dengue virus as well. For those dealing with a primary care, you are aware of initial situation of patients with arbovirosis may lead to the need of a better differential diagnosis. And even given this huge magnitude of 2016, we still have 20 to 22,000 cases per year of Zika virus. It doesn't mean necessarily congenital infections, but overall infections identified, infections by Zika virus in the Americas as a whole. Another very relevant topic under the standpoint of prospect and what was done historically is both a care in terms of developing guidelines for a good clinical diagnosis as well as treatment, and the Pan American Health Organization in partnership with the CIDACS as well as the Ministry of Health, it favored the possibility of generating and disseminating information. So we have done this in 2016, 17, but then 2020, 2023. These are capacity building seminars to help professionals to diagnose and treat patients so that the Americas would have a common pattern, as well as the development of guidelines for the control of vectors and treatment, because we know that the Egyptioid doesn't only transmit Zika, but also chikungunya and dengue. I know that this panel is on Zika, but I would like to mention these settings. Zika virus turned 9 years with a no susceptible, without a no geographical infection frontiers. The virus seems to have some sort of genetic stability, and it seems it will be one of the most important aspects. Just as it happened with the COVID-19, it is a stable virus. It is not uh, exploding in other countries, but it is still spreading. The settings are the settings of climate change is leading not only to new areas of circulation of arboviruses, but also we have the circulation of 4 dengue subtypes, and last year we had the largest epidemic of dengue, not only in Brazil but in the Americas, and chikungunya also accumulating uh, the development of a virus that was quite common in the Amazon region. But when we started to diagnose, and then once again, I congratulate with the Fiocruz for this, it spreads. And now we have cases from Panama with up to South America, cases of Uruguay and Paraguay. And 20 years ago, if we thought we would have any of these cases north of Argentina, we wouldn't have been respected. Today, um, we have the climate changes, and we have new cohorts of Zika virus, you know, and at the same time, we're also experiencing other outbreaks, not only in Brazil, but also in many Western coast countries. So this is the actual settings. And I'd like to start by, thank the opportunity to be here talking to you and to tell you that with projects like this, we can keep alive care for children and their families, but also the need to avoid new situations such as those. Thank you very much, and I will give you the floor back. Thank you, Yuri. It was very interesting to see it and realize the importance of not only Zika but other arboviruses that are circulating in South America, and we will discuss it again during the Q&A session. But now I'd like to give the floor to Luciana. Luciana is the president of Unizika Brazil. Luciana, you have the floor. I cannot see. I don't see Luciana. See now? Yes. Thank you. Thank you very much for the invitation. I am Luciana Arraes. I am currently president of Unizika. This is a nationwide association uh, uh, to fight against Zika. We always believe that, attending such events is extremely important. In every meeting we took part, we mentioned that it is impossible to develop public sciences for the patients affected by it when we are not there. But thanks to the efforts by Unizika and several other organizations, the Zika congenital syndrome and Zika outbreak is still active. We have been forgotten for some time, but thank God we came back to make history. We came back to occupying space. We came back to being commented on, and I thank you very much for giving us this space. I am running between work, treatment, and Unizika representation, but I would like to now express my gratitude and for everything that's been done. Unizika, after we met Doctors Lisa and Alba, the director of the Division for Health Surveillance in the Ministry of Health, um, thanks to them, we are now having the children being followed up and treated in different states, some with more care and attention, others not so much. But it is still very important to have the acknowledgement, that the children need these follow up. I'm not sure you are all aware of it, but the latest achievement of Zika affected children was the approval of the bill on the 1st of July, and regulation was done recently in August, which is a long life pension to all children affected by Zika virus in our country. But even better than the financial support is the acknowledgement of, by the state that although 10 years, with a 10 years delay, we're giving them the opportunity to have a dignified life. We have already started working with those at the National Institute for Social Welfare, but we must expand this discussion because, like I said, it's not just the financial element. Financial element gives us comfort, but we need to care for the patients. We need to go back to the Ministry of Health and to the state departments of health to hold workshops and decide to be done after the legislation, after the regulation, so that children will still uh, being cared for. The financial support gives them some um, life, quality of life, but what is already being offered to the children cannot stop or because of the financial support. We must expand the follow up as well as the treatment and care for children. We know absolutely well that much has already been done, but we have to work hard to avoid a new Zika outbreak. I was talking to a neurologist here in the state of Ceará yesterday. She was one of the earliest ones working the reference hospital, and she leaves it quite clear that probably if we do not develop a vaccine or if we do not expand the care, we might have another, what can I say, another generation of children with a Zika congenital syndrome. Um, those who were children 10 years ago now are, nearly grown up, and we have to be very careful with them as well. So thank you very much for the space, and I am always available to help develop everything that is needed. Thank you very much. Thank you, Luciana. We thank you, actually, because it is very important to have your perspective. It is important to have the perspective of the healthcare, but without the perspective of the children, there would be something missing. Thank you very much for joining us in our panel, and I will give the floor to Dr. Livia to keep going with our seminar. Folks, please keep your questions. You can even write those down on the chat tab because in the end of the panel, we will have some time to discuss it with the different speakers. Thank you. Thank you. Good morning. Thank you for the invitation. It is an honor to take part in this panel with all these researchers as well as Dr. Luciana Reis. I call her doctor because she calls me a doctor. So I am already referring to her as a doctor. She has a beautiful story together with the angel mothers and other families. Thank you very much, CIDACS, for the invitation. I will now share my slides. I hope you can see it well. Can you see it? I can start, can't I? Yeah, we're just missing presentation mode, and now it is. Thank you. Yeah. I think this is not the very beginning. Hold on. No, it began on the wrong slide. Now, yes. So when I talked to Dr. Teixeira and I asked what were the expectations, and it was a challenge to do it all in 10 minutes, but I kind of gather this data on what the Zika outbreak was 10 years ago, and I hope I will be keeping with the 10 minutes. We started to acknowledge an autochthonous Zika transmission in May 2015. when the first cases were confirmed. But we were already acknowledging an outbreak of a disease in the semi-arid region in the northeastern Brazil, and those cases were positive for dengue fever, since we are talking about viruses belonging to the same family. We did the serology, and those cases were positive for dengue, but in May we ended up confirming the very first cases of Zika. We knew that we were dealing with a new arbovirus. And in November 2015, with the outbreak of microcephaly cases, increased Guillain-Barré syndrome cases, they would have to be reported immediately. It was important because without this standardized reporting, we would have no idea of the disease burden and at the same time we declared public health care emergency. It was declared by World Health Organization in February next year, in 2016. So in November 2015, we identified Zika virus in a blood sample of a neonatal umbilical cord, and it confirmed the relationship between the congenital syndrome and the virus. A series of surveys were done thanks to the quality of our researchers in our institutions, and then Brazil turned out to uh, show this association to the world, and it researches quite intensively. Zika only became a mandatory reporting disease such as dengue and chikungunya in February the following year. This is important because whenever I show you the cases, they are biases. They were not. Actually, in 2016, we declared the end of the Zika epidemic. We had three milestones: the beginning, the very first cases of indeterminate symptomatic disease increased in Guillain-Barré syndrome, and then microcephaly and other congenital alterations. Like I said before, we were only able to identify it as a country because we had a network of healthcare professionals realizing there was a cluster of children being born with a congenital syndrome, which was then named congenital syndrome because earlier was just microcephaly, having a healthcare system that is sensitive to it, and research. Zika has always been a concern of our public health authorities. I extracted these um, statements by Dr. Claudio Merovich. He was our director for communicable disease, and he said we had two priorities. One of those was to work better with the infestation of Aedes aegypti and to ensure full support to families and patients. So the concern of 10 years ago is still current concern. And how did the federal government responded to it? A series of protocols were put together, a nationwide a plan of coping was developed, one on research, the other on healthcare, and the other on surveillance. And meetings were called by the presidency of Brazil, which also invited other ministries to join the activities. And we had a command and control room mobilizing states and municipality for the vector control of Aedes aegypti. It was led by SVSA, but also with the participation of the primary health care divisions. And even the president at the time, who was Rousseff, took part in nationwide campaigns. That time it was a mosquito cannot be stronger than a whole country. Wanted to bring this image to show you how important it is to have the engagement of the whole government and not only the healthcare division. One important milestone was an international meeting where alternatives for the control of Aedes aegypti in Brazil were discussed. We had experts on several different continents, and we discussed how to improve the vector control and leave that households visit and the use of insecticides. A series of measures were recommended as a result of this meeting. One of those was that Brazil should adopt a risk mapping, also use insecticide spraying stations, working on household cleanup, but also technologies for pregnant, such as with insecticide embedded curtains, working inside households, and do individual protections with a mosquito repellent. Other technologies were recommended. It required more research so that it would become a public health measure. Here we have the Wolbachia, irradiated sterile mosquitoes, and the use of biologicals. I will uh, very briefly talk about the epidemiological situation of Zika today, and then I will show you how much we have progressed. Since Zika became a mandatory reporting disease, Brazil recorded more than 300,000 likely cases, and those 200,000 were confirmed. Our possibility of a quick diagnosis was poor, but it improved in time. Those were the cases between 2015, 2016, a little bit in 2017 as well. And like Hilton had already shown, cases decreased importantly as time went by. With the pregnant women, we have 12,000 cases confirmed, just over half by lab criteria, and those confirmations were observed in the three first years of disease reporting. We also faced some deaths which were associated to Zika, and we're not talking about congenital syndrome. We're talking about people of different ages that progressed to they ended up dying. The last one, or the latest one, the latest Zika confirmed death was 23. We had three in 2022. It shows that the virus is still circulating, although without important outbreaks. Most deaths took place in Bahia, Mato Grosso, Rio de Janeiro, Maranhão. Other states reported just a few, and I'm talking about accumulated 2015 to 2023 data. I hope the map is moving to show you how cases displaced within the Brazilian territory, but it never stopped being concentrated in Brazil's northeast, even when it also circulates in a smaller volume as we've been observing. And talking about congenital Zika syndrome, we had more than 21,000 reports with over 1,800 cases confirmed. Criteria are not simple, they're quite complex. They would have to undergo lab diagnosis and consider a spectrum of alterations. And the states with the most cases confirmed are Pernambuco, São Paulo, Bahia, Minas, and this is the actual situation. But the northeastern of Brazil is where we have more cases confirmed. And according to the data in our system, although we know that researchers dive deeper, and by comparing database, they will find even more cases. We had 260 deaths confirmed as resulting from congenital syndrome. We still have many thousands of children living with congenital syndrome. What was done after the end of emergency? We advanced with diagnosis. Today we have an RT-PCR multiplex test, and in the same sample you can tell whether we're talking about dengue, chikungunya, or Zika. We also developed a nationwide plan for um, Zika congenital syndrome. This plan will be launched this year, and it involves surgery as well as following up the children. This year, we published a vector control guideline where we incorporate those researches that I mentioned earlier. Those had been recommended in a meeting to become a public health care policies that were funded by the Ministry of Health and followed up for 6 years. And we translated that knowledge so that it would become a public health measure. We are actually invested in this initiative as complementary to control activities. We also have a permanent dialogue with the civil society. Health specialized care department is working hard, but we acknowledge there's still a lot to do. And this congenital Zika syndrome is included in the primary care approach. This is a project that is visiting states and working together with the building the capacity of family healthcare professionals. It includes early diagnosis essays and others. 10 states have already been visited and worked out under this strategy. And one of the main achievements, and this achievement is a result of Mães de Anjo team efforts, which was the approval of Bill 15156 of July 1st, 2025. It compensates families for moral damage, and then they will also get a monthly lifelong pension. I will end with a picture from our colloquial last year in Pernambuco. It was a very important time of integration, and it shows how this dialogue has to be kept alive. We are all together in this fight. Thank you. Thank you, Olivia. It was also very interesting to understand not only where we are now, but when we started in 2015 at the time of the outbreak. So it kind of took us back in time. Also understanding what we should still be doing or we can do. I'd like to give the floor now to Dr. Selena. She's been together with us since the very beginning as well. So you have the floor, Selena. Good morning, everyone. Well, first of all, I'd like to thank for the invitation. It is a great honor to share this webinar with individuals I admire so much and realize how successful mothers of affected children are, and it makes a difference in the lives of everyone. I will focus my talk. Can you see it now? Do you see my presentation, my slides on the screen? Yes, we can. We see it. Anyway, I will focus on response to research about the Zika epidemic, both before emergency and post-emergency, on behalf of this group, MERG, the MERG group. MERG was microcephaly epidemic research group. It gathered researchers from local northeastern institutions, and since 2015 we are working in close collaboration not only with the community affected but also with the policy managers as well as national international scientific communities. Here I have the challenge to turn 10 years of research into 10 minutes of talk. But this challenge of mine was made easier by those who preceded me. But in 2014, we had a warning from the World Health Organization for chikungunya. So that was a virus that had also been found in Brazil's northeast. There was this concern, and in those times they said Zika is not a threat, it is a benign acute disease, and only recently we had the recording of outbreaks. So the knowledge we had on the Zika epidemiology before its introduction to Brazil was of a disease that could bring outbreaks, but benign in general and associated to Guillain-Barré syndrome. When we get back to our Brazil setting, when we look at this map is a map dating back to 2016, early 2016, showing this important regional difference of notified states. This cluster in the northeast of Brazil, there are about 50 cases per 10,000 born alive, but it wasn't only about this region. There were a smaller cluster in different regions of Brazil. We should pay attention to this. The epicenter of this epidemic was the city of Recife. And just to reinforce what has already been mentioned, it's like the Zika virus had found a group of individuals susceptible, an abundant presence of Aedes aegypti, very favorable environmental conditions, a densely populated urban space, what we started to call a perfect storm. And in this perfect storm allowed us to detect the potential clinical outcome of the infection. Increased in cases of Guillain-Barré in adults, and 6-7 months later, a group of children born with microcephaly and other congenital abnormalities, which was was a microcephaly of a unknown cause. For us, epidemiologists and those who were in the epicenter of this microcephaly epidemic, what have we established as priority? You know, first, we had to describe the spectrum of this disease. Description of cases is a zero of any epidemiological study. Second, to research the causes of microcephaly. So, what causes it? What was going on? And then measuring absolute and relative risks of adverse outcomes of pregnancy through cohorts. As it has already said, I mean, I like, showing these pictures of those times because now Brazil declares an important public health emergency followed by the Pan American Health Organization emergency call. And in this picture, what we have the director of the Pan American Health Organization, Dr. Marecha, president of Fiocruz, and the Ministry of Health. We can see, the visibility that an outbreak like this for the large number of microphones during an outbreak when the highest authorities of a country or international organization declare public emergency, there is a great mobilization. And I confess that in my long career as epidemiologist and working with communicable diseases, was the very first time I saw an arbovirus communication relating Zika to potential congenital abnormalities. So this realization of a vector control is a very important thing. So we realized that this arbovirus infection was considered as the probable etiology, but it needed to be proven. A very important thing that we should keep in mind is that during the outbreaks of microcephaly, many countries, including Brazil, Colombia, Honduras, El Salvador, and Jamaica, recommended the postponing of the of the event. You wonder what this communication meant to the population. Postponing pregnancy, that was it. I mean, that was a very hard thing to do. So here I bring the picture what I believe to have been the very first meeting on Zika held at the AG Magalhães Institute. This is a very interesting picture because we've been observed by Osvaldo Cruz on the large picture on the wall. It seems to be a continuity. This was called the ABCD of Zika because that's how stunned we were. We knew very little about what happened to the population, in face of this outbreak. And once this public health emergency was established, that was a milestone, that was a turning point in public health response, given the scientific mobilization and everything related to the ocean. That was the very first magazine. It was the American Journal of Public Health bringing on its cover the picture of a child with microcephaly, and it's called the Zika epidemic, the tragedy and opportunities. If I'm not mistaken, this was written by Laura Rodriguez. And the very first attempt, this was the very first attempt to organize the little that we knew back then, the cases of serious issues of surveillance, etc. So, I'm sorry I brought this picture, but it is important to remind ourselves how newborns would be represented in the community. It's a very several, I mean, a very severe microcephaly, lack of proportion and a series of abnormalities in CT scans and other images. And a clear implication of it was that the public healthcare system had to be ready to provide those children with multidisciplinary and complex care that they would demand throughout their lives. But also, as epidemiologists, we were aware that the most severe cases were those being initially diagnosed, the so called selection bias, right? And in this article that this group from Recife, together with Dr. Laura Rodriguez, they tried to include Zika among the other congenital syndrome because we can read that it was a presumed diagnosis, a congenital syndrome vector borne, different from other congenital best known syndromes that cause microcephaly, such as rubella megacephalovirus. Getting back to this topic, during the epidemic, one of the very first missions of the Pan American Health Organization and the World Health Organization assigned it was to control a case controlled study to investigate the situation, because a single case with a viral identification in mother and fetus doesn't prove association or even a collection of cases. So we needed to start researching. And because we already had the cases, we could not develop cohorts of pregnant women. So we started to do the control based on controls during the epidemic. So we included newborns from women residing in the city of Recife. Control cases were created prospectively in the operating room of 8 public maternity hospitals. You wonder what it meant in terms of operational challenges during an epidemic, having teams visiting all hospitals to identify cases and carry out measurements during the delivery. But in talking about methodological issues, because you can actually read it in the published articles and what kind of definition was done, all the lab tests and everything else, what I like to highlight is that epidemiological studies are part of response to research during public health crisis. This control case demonstrates that it is possible to do it during a crisis period. Studies that will actually offer answer this question. It is or it is not Zika. We call this kind of research wartime research. You have to outline, carry out quickly, but with a methodological strictness. When I look with the rear mirror now, it seems to be clear that it was only possible to hold this control case study in the city of Recife during the epidemic, given the local competence, the broad collaboration of local institutions and agreement of women, mothers, and communities who understood that we needed to give this answer. We needed, at least we needed to try to be as scientifically strict as possible. And I would also like to let you know that we had a very fast release of financial resources by the Ministry of Health and the World Health, actually no, the Pan American Health Organization. It was essential for us to carry out in 2016 during the epidemic. So this opportunity we had to do it, we did because it was a good relationship, and I was quite impacted to see that both Pan American Health Organization as well as the Ministry of Health, they understand what an emergency is. What emergency is. When we talk about emergency, how fast the processes flow, how fast things are done, really. And as a result of this study, there was a strong association between microcephaly and Zika virus infection. And this study provided the evidence that it was not the use of vaccines during the pregnancy that would lead to microcephaly. Those were ideas that we heard on from the press and or institutions. So, but what I meant to say is that today, in the scientific community, there's enough evidence of causality of Zika, of congenital Zika syndrome. We have many control case studies here from Pernambuco, what was done in Paraíba, several cohorts studies, the very first one in Rio de Janeiro showing this. I mean, large studies, experimental studies in lab animals, in animal models and all. Why am I insisting on emphasizing this? That is because today we have strong evidence showing that this arbovirus is neurotropic, it is transmitted, and it leads to this nose syndrome. So I say it again that not even this consensus in the literature, filling out all causality, plausibility, and reproducibility assumptions decrease the noise when we talk about congenital Zika syndrome. Well, there's several speculation on water and air and everything else. I mean, it's to tell you that during this microcephaly epidemic and this epidemic in microcephaly, Zika virus was responsible wherever you look at it. How about post-pandemic? After the emergency, of course, the focus decreased. We didn't allow it to be forgotten, though. The whole group was engaged in developing collaborative plans. We collaborated to the Zika plan that was a large consortium from 2017 to 2021 with the support of European Community, also with the support of World Health Organization for meta-analysis and individual analysis into national cohorts, as well as a ZBC, that's Zika Brazilian Consortium, is still producing a large amount of interesting information in a systematic and rigorous way. And as the result of ZBC efforts, I'd like to mention about the risk. So nearly everywhere in Brazil, with the exception of the southernmost region, when we gather individual cases of more than 1,500 pregnant women, we learned about the risk of microcephaly upon birth and during the next 2 years of follow-up. And there's this article, I think it's a very interesting one, because here we're talking about the natural history of congenital infection by Zika virus. Those are positive women and the different outcomes observed throughout the period. So it is quite clear that if the outcome is only measured at birth, it underestimates the medium-term outcomes in first and second year. But also, if the only we only get microcephaly as outcome, we may also miss other adverse outcomes which would increase the absolute risk. But what seems to be very interesting in this article is that for the very first time, with actual data, we realize that the risk of the syndrome is stable at different places and it doesn't seem to be modified according to the geographical localization or ethnicity. But so it answers a question that was asked by the article, which was whether this risk was stable or varied by per region. So the information is that this risk is stable also in different regions. Our group also concerned with establishing this congenital infection spectrum, and we recently reviewed our clinical findings. And in this cloud of words, we see that large Brazilian production is still on microcephaly and adverse effects, throughout time, such as epilepsy, dysphagia, motor dysfunctions, etc. And as we reviewed it, what called my attention was that Brazil had really produced a significant amount of knowledge in this field, not only early in the epidemic, but also throughout these studies and children's cohorts that were being followed by different services. And then to tell you that this pediatric cohort that's being followed up, of course, shifting monitoring regimens during COVID pandemic. Here we see children being vaccinated. We had an intersection between COVID pandemic and Zika epidemic. And now we are participating in long-term impact studies also together with the Fiocruz Bahia group and the London School of Health and Tropical Medicine under the coordination of Dr. Elizabeth Brickley. And now we would like to invite you to the next meeting that will be held both presentially and online. Presentially in Recife, where we are going to celebrate these 10-year milestone of the Zika epidemic. I hope you have the opportunity to attend. We're planning it with a lot of care, and it will certainly be a wonderful opportunity for us to discuss the different aspects of it. And to end, I'd like to once again tell you how honored I am to having worked with the different institutions and with such a distinguished group of Brazilian and international professionals and researchers and healthcare professionals. And I'd like to thank you very much once again for the invitation. Thank you. Thank you, Selena. I think your talk made it quite clear how important scientific collaboration is to give important answers not only to the scientific community but to the population at large. Thank you very much. And I would like to now offer the floor to Professor Agenor. You have the floor, Professor. Please, Selena, stop sharing, otherwise we cannot have another one shared. Thank you.
Você está no mudo, Agenor, a gente não consegue te escutar.
You are muted, sir. We cannot hear you. All right. Okay. Now we can hear you.
Eu passo daqui?
Can I start from here?
Bom,
well,
primeiro,
first of all,
eu gostaria, pode projetar, Vitória, por favor.
you can please share my slides. Yes, we will share it from here. Thank you.
Bom, aproveitando o tempo.
Okay. First of all, I would like to thank CIDACS for the invitation. It is an honor, to take part in this seminar with such distinguished individuals. My talk is different from what was mentioned so far. I'm bringing something different. I will mention how the Zika epidemic was addressed in Brazil. It's important to mention this because we recently witnessed the management of COVID-19 pandemic and its consequences. I will offer a summary to let you know how the decisions were made, institutional and political organization to face the epidemic, the national Zika plan, what it meant, command and control national room, and what was suggested in the panel, lessons learned, which I mention as a big lesson learned. Next. Well, very briefly, whenever you see 2005, please read 2015. We started to observe Zika cases in Brazil, but without a major concern. After a significant increase in October 2015, as executive secretary at the Ministry of Health, concerned with the situation and talking to Minister Marcelo Castro, I asked epidemiologist colleagues what it meant. I talked to Jackson Pena, Maurício Barreto, Rivaldo Venancio, and Gloria Teixeira. Coincidentally, they all agreed, and I had no doubt. It was about 10 p.m. I called my colleagues as SBS, and we scheduled a meeting for the next day at 8. There was an important support to declaring health emergency. The WHO resisted to it, so we decided instead of waiting for the WHO, we would declare a nationwide public health emergency. So we told the minister agreed in making this announcement. So at 4 o'clock am during an interview. The minister declared it. It was a political and institutional organization that was put together to face Zika epidemic. We also showed this to the president of Brazil, and she undertook the coordination of actions to face that situation. She also determined the engagement of all government departments, and she monitored in person all activities. And she determined the nationwide coordination to be done by the Ministry of Health. We have to understand this as a very relevant thing, because when we observe, since 1970s to date, all major problems, all major sanitary crises we faced, from the meningitis outbreak to problems we've faced recently, such as the recent outbreaks and even Zika, all uh, activities were coordinated by the Ministry of Health. And she determined, once again, and she also determined that the armed forces, civil defense, and other ministries should be under the coordination of the Ministry of Health. And more than that, they should meet all demands imposed by the Ministry of Health. That was very important. It wasn't just a rhetorical, because the president of Brazil monitored presentially what was going on. And more than that, you should remember that several ministers in the armed forces and other ministries attended events that approached these issues so that we could have a coordinated task force to face Zika virus epidemic, and an important communication strategy was also put together. So this political and institutional organization was, as I see, the most important thing we did. It took months, and it was a very important time politically, because she was facing important pressure that ended up in the 2016 coup. So we had a Zika addressing plan coordinated by the Ministry of Health together with the uh, Chief of Staff. And Livia has mentioned it. I will briefly mention more the activities to fight against the mosquito, caring for people, and also research, capacity building, and technology development. We are here today as a result of all these three activities. Next, please. And then mobilization and fighting mosquito was a very important element. Many times we don't pay the due importance. We don't realize how important it was, and I see it as very important. The implementation of the nationwide command and control room. This command and control room was put together where we have the command and control room of the civil defense, and all ministry, all civil institutions taking part would have to assign a representative full time, so that every demand from states or from municipalities would be forwarded by the representative of that particular organization. The focus was fighting against Aedes aegypti. An interministry and interfederative network was very important because you cannot fight against an epidemic or even a pandemic without a reaction from all partners in the healthcare system, states and municipalities, under the coordination of Ministry of Health and in integration with the Chief of Staff and the Civil Defense. So it was very important to have the civil defense participating because they have representatives in every state and in all capital cities. This command and control room played a very important role also because many states also created their own command and control room. And also we also implemented the COIS. COIS is the Health Emergency Operations Center. And the role of scientific intelligence was played by it. So we have one operational thing and a scientific element also, all under the coordination of the Ministry of Health, Chief of Staff, and Civil Defense. And in this command and control room, you had the different aspects such as the health, civil defense, national integration, education, defense, government department, state department. It worked in all states with irregular video conferences under the central coordination of the civil defense, given its capillarity and presence in every Brazilian state, and the Ministry of Health would coordinate it together with the civil defense. So much that in this situation was led by a professional from the Ministry of Health. Next one, please. So this is just to briefly show you how it was done. The objective was to ensure timely and proper care to children and their families throughout the country. And Selina mentioned this quite interestingly. Main activities would include diagnosis, qualification, and expansion, lab support, um, uh, telehealth, organization of a network of care, and professional capacity building. There's no details about it. I'm just mentioning the topics. Technology development, education, and research. This is also very clear. We were concerned with the diagnosis. We had to ensure resources for it, as well as a vector control, research on Zika virus and its relationship with other diseases, vaccine treatment, as well as innovation in health service management. And here I should also mention that thanks to it, the National Congress assigned significant financial resources to be allocated to the Ministry of Health. And with this, we could support many activities, including the platform we are addressing right now. And to end, I mean, there's, the most important thing are the lessons learned or the big lesson learned. There is an article in our constitution that I don't see mentioned many times, although it is one of the most important articles in our constitution about the Brazilian healthcare system. It refers to the public relevance of health actions and activities. Thanks to this constitutional article, we could turn the role of the Ministry of Health to be respected. Also, technical and political approach to an epidemic is absolutely essential. It belongs to the Ministry of Health and its interfederative partners. Zika showed that such an important problem is a government priority. It is not a sector priority. And many times we make mistakes believing that a sector priority will take care of it. It will not. It's useless to believe that just approaching a or some activities or highlighting the importance of a specific sectors of others, and then you believe priority is a sector-oriented priority, but it is not. In the health area, this is much bigger. In Zika, it was a great example. It is a shame that years later, this experience and this example were not taken advantage of by the successors of the administration. Thank you very much, and I am at your service. Thank you, Agenor. Also, very interesting to hear you highlighting our role, the role of the Ministry of Health in responding to this Zika epidemic. We don't have much time for questions right now, but I would like to ask a question to the panel, and any of you can answer it. It is a question, but also it is a provocation. I realize that many talks approached vector control, but I'd like to remind you of an article published on the Lancet by Professor Mauricio 2010. We only had a dengue fever, but he already mentioned dengue as a failure. A failure, one of the infectious disease that we we failed to control. And then we mentioned the vector control as priorities, but it doesn't seem we have advanced much 10 years later, since in 2024 we had a record dengue numbers all transmitted by the same mosquito, Aedes aegypti. So I'd like to any of you to talk about this thing of vector control, and also Luciana mentioned about the vaccine. Agenor also mentioned as a priority technology development. I like to hear from you what would be the role that a vaccine would play in congenital Zika syndrome and other arboviruses as well. Well, this is open to whoever would wish to talk about it. Well, I will start then, answering to your provocation. It's very important to talk about it, but I will use Dr. José Agenor's talk because we are speaking about a public health problem that is not exclusively on the hands of public health. If we do not improve the life of the population in terms of solid waste disposal, sanitation, etc., we will have to cope with this and other viruses that Aedes aegypti can transmit. Brazil has 97% of its territory infested by the vector. We already know that any rate of vector presence can transmit infectious diseases. We cannot tell that under a certain percentage it would avoid an outbreak, but the presence of the vector is essential to the transmission of infections. So we are trying to shift the strategy. And in this change in strategy, we are working with the territory and its vulnerabilities. We don't have a homogeneous territory. We cannot say that whoever lives in the region that is well served with waste collection, water supply, and good sanitation will not have the same problem of those living in uh, um, deprived neighborhoods. So we also have inequalities in the territory that would favor the spread of vector-borne diseases. So we have to work the territory in a more intelligent and accurate way in hotspot transmission areas where new technologies are being scaled up. For this year and next year alone, Brazil is investing 170 million reals for vector control and innovation. I'm not talking about the acquisition of insecticides or larvicides or paying for epidemic agents or no. We are talking about different initiatives such as Wolbachia and risk stratification, which is a turning point in our approach. And recently, we've also experienced important global climate changes. We are having chikungunya transmission infection in Europe, such as France, for instance. It is a highly uh, domiciled vector with the capacity of transmitting important viruses. But there is a whole structure, I mean, the whole question of the structures in cities and climate issues as well. This is not an easy to solve problem. And if I can use the words of Giovanni Niquello, my eternal boss, I call him boss even today. If it were easy to solve, someone would have already solved it. The problem is that we, not only Brazil, but other American countries and other countries around the world will certainly be facing this important challenge. Last year's epidemic was not exclusive to Brazil. Of course, we were very important in the statistics, but Brazil reports all suspicious cases and all those that were not possible to confirm as cases. Our statistics will always be greater than those of our neighboring countries. So the engagement of all sectors in society is essential. So this is it. If anyone else would like to help answer, yes, thank you. Yes, thank you, Lívia. Agenor.
Você está no mudo. A gente não consegue.
You are muted, sir. We cannot hear you.
Essa provocação que você fez, ela é muito interessante.
This question of wars is very interesting. Why? Well, first, we have to quit talking about rhetorical priority. Rhetorical is quite interesting, but in the development of a vaccine, we must have care so that whatever support we can offer will be truly used. I'll give you two examples. In chikungunya, we invited an important Brazilian researcher who had an opportunity to share his experience in integration with an important American university to develop a chikungunya vaccine. We supported, we sent personnel to U.S. chikungunya, not Zika, but chikungunya. It was Pedro Vasconcelos. I'm sure you remember him. But the impact wasn't exactly what we expected, so that we would help develop a vaccine. We are at a technology development phase that we have to reinforce this. I will give you another example. Dengue vaccine being launched by Butantan, the Ministry of Health offered 100 million reals for the development of the dengue vaccine. 100 million reals. And the issue of how to get those funds to Butantan was us. I mean, we did it. We negotiated with Alchemy and Khalil. Who are they? Governor, Secretary of Health, and the President of Butantan. Those were three. To date, I really still don't know how their research evolved and how the vaccine development is doing. And why am I saying this? There's a mandate that belongs to the ministry, and we can not forget ministry has to undertake its leading role in this issue. I'd like to mention to you, and this is something that I've been mentioning quite often, I believe that it could have been done differently. If MP4 in Campinas were under the management of the Ministry of Health, it would certainly bring peace to the science that is supported by the Ministry of Health, or in which the Ministry of Health is an important actor, but it's not. Have we got any priority there? I'm not sure, but I don't think so. Basic research is important, yes, it is. But I believe we have to undertake the leadership role, which is not only the rhetorical leadership role, you see, and according to the responsibility that belongs exclusively to the Ministry of Health, and we have to fight for it and go forward with it. And the issue of Zika is similar. All previous epidemics showed us the same thing. All major sanitary crises we faced before COVID were coordinated by the Ministry of Health, and it wasn't simple. Starting smallpox, for instance, we have several researchers who have studied it. Smallpox in the 1950s until now with the Zika. All these issues were led by the Ministry of Health. The ones that didn't count on the leadership of the Ministry of Health, it was just played a secondary role, and if it were not for the secondary leadership, things would have gone south. Thank you, Janor. Wildo, we are really late already, so if you really have to say something, say it briefly. Thank you. Yes, I'd like to answer this from two different aspects. The dengue epidemic last year affected many American countries. We have widespread, not only down the south in Uruguay, but also in Panama. So the spreading of the disease is taking place quite fast as a result, not only climate change, but 25, 27%, 13%. It depends on the countries themselves, people experiencing uh, situations in countries where things, where they do not have access to strategies. Under the standpoint of vector control, we already have a framework of many initiatives. Strength is being healthy, but the capacity to produce knowledge should be increased so that we would benefit from both the vaccine as well as vector control. And then the role of the health system is essential. Otherwise, we would only be migrating from one epidemic to another. The scenario could be worse than, even worse than what we have had, what Selena showed in her talk. When she says how much Brazil has contributed. The last topic has got to do with the keeping effective budget for long-term studies. Brazil is used to making short-term investments, but we know that to generate important knowledge, we need a long-term fixed budget and investments. It interferes in the development of knowledge, and this is very important. Thank you very much. Look, we're running out of time. I will summarize all questions in just one. It's about the classification of congenital Zika syndrome. Some are asking because there seems to have been a reclassification on health reports. I will ask this question to Livia because you see is a representative of the ministry. So Livia, if you could briefly talk about this. I will have to talk about briefly because I didn't take part in the classification, but I can tell you that those definitions have been changed. We were quite sensitive to communications. I read the comments here, but any infection is classified as congenital infection, not necessarily by Zika virus. So a reclassification was carried out, but I believe that if it, I mean, it's very important to mention the method of the reclassification. Therefore, I will take this to the team who was responsible for it. We were at a time of a transition. The congenital syndrome was not followed up by the arbovirus division. There is a technical division for non-communicable disease department. They are supporting us in this transition, and we will publish an updated report on it. It is also very important to mention the method that was applied to the reclassification, but no doubt it also influenced the decrease. Thank you, everyone, for your participation. Now we are going to end this first panel, but do not leave the room because we will have the next panel starting right away. Tem gente negativa, então, obrigado e desculpa, obrigado e, por favor, continue a reunião número 3.
Obrigada, Eni. Para dar sequência à nossa atividade.
Thank you, Annie. Next, we'll have the second panel. And after the talks, there will be 15 minutes for Q&A. This panel is called The Originality and Importance of the Zika Platform, a longitudinal study based on the integration of the secondary data. Professor Maurício Barreto is professor at the Federal University of Bahia, founder and scientific coordinator of CIDACS. I am also one of the speakers. I am currently at the Executive Vice Coordination. I am an employee of Fiocruz, CIDACS, and my activities include listening to Science and Society. Professor Gloria Teixeira, unfortunately, had a severe problem in her family, couldn't be here. But we will also have a Wagner Martins, the strategic coordinator of Fiocruz Brasília, who first faced Zika in 2016. Rita Vasconcelos, coordinator at Communications Department, Diversity and Inclusion Center, Pernambuco. She integrates the Social Communication Center of Fiocruz. I'll give you the floor now, Rita. Thank you. Good morning, everyone. I'd like to start by thanking CIDACS for the invitation to moderate this panel, but I cannot miss the opportunity to tell you that Zika and the work performed by Merck, notably Salina and Ximenes, were very important for the communications advisory department. To understand, what researchers wanted to convey. That was an important professional milestone. Right now, I am in Rio de Janeiro. That's why I have this jacket on, because it's raining here. But it was very important to take part in this Zika research. I had already witnessed some epidemics. Only HIV AIDS had such an important impact on us as a Zika, even more than COVID, at least in the area of Pernambuco. So I needed to make these remarks. I believe we should be writing about it. So we will begin the panel right now. And like Betania said, Professor Maria Gloria Teixeira will not be able to participate, and it offers the remaining panelists 2 or 3 additional minutes. I would like to ask speakers to speak a little bit slower so that our interpreters can uh, interpret everything you say. Okay, thank you. So now I give the floor to Professor Mauricio Barreto.
Colocando aqui eu queria saber, tá Sherry, tá...
Agora está aparecendo, mas
can
não,
you
não,
see
não,
my
não apresentação ainda.
slide? We can see your slide, although not in presentation mode.
Agora?
How about now?
Agora.
Yes,
Bem,
we
eu
see.
queria primeiro agradecer também estar
Well,
aqui.
first of all, I would like the opportunity to be here with you. I will give a brief introduction to some things. I will not be mentioning every detail, which our colleagues will certainly address later on or tomorrow. But because Gloria is not coming, I would like to tell a little bit of what she would mention. Of course, I will not be able to speak as fluently as Gloria because she's an expert in arboviruses, but I've included a little bit of her topics. I've included in my presentation some of the topics that Gloria would be mentioning. Well, I think it was Eni who mentioned it. In 2011, a group of researchers wrote a review article on a special Lancet edition on infectious diseases, or successes and failures, and success infectious in failures in the control of infectious diseases in Brazil. And in those times, in 2011, Brazil had been very successful in some diseases, but particularly two issues: dengue and leishmaniasis. Those were cases we regarded as failures. And that's because, I mean, there were a series of arguments. I know how difficult it is. Olivia mentioned how difficult it is to control, but it is a clear case of a failure that we didn't manage to stop the growth in dengue infections and the more severe dengue cases in our countries. And this is his story. I mean, in 1881, dengue re-enters Brazil. In 2014, we have chikungunya. We wrote our article in 2011. In 2014, we had chikungunya, and in 2015, Zika virus. So this is a succession, and others as well. I mean, are taking place and may still take place regarding communication possibilities, particularly by Aedes aegypti mosquito. And I wanted to call your attention to the fact that this is a huge problem in the Brazilian society, and it is always present. Of course, there's been important efforts by many Ministry of Health administrations. They devoting efforts and assigning technical groups and all, but no doubt this is a problem that we've been coping with for quite a while. Many have mentioned the story of Zika. Zika starts to be realized as a problem. It wasn't Zika yet. It was a problem with of children being more born with a microcephaly, especially in Recife in 2015, and it evolves. I mean, knowledge, observation, and everything else. But one important thing I'd like to call their attention to is SUS. SUS is the Brazilian public health care system. Agenor mentioned, but I would like to comment on how capable SUS is. That was realized in the primary care system, public system, and how fast we managed to connect it to surveillance systems. It allowed us to realize there was an issue in the country, and the Ministry of Health was extremely agile to begin research, to begin surveys with the technology and scientific community. And within a few months, we already had a nationwide public emergency call. And even the president of Brazil herself undertakes the coordination of a process which was very important. Several committees were created. The Ministry of Science and Technology played an important role. I was a member of a committee created by the Ministry of Science and Technology to take part in the process of coordination and elaboration of scientific approaches. Epidemic was or is more confined to Brazil's northeast. Recife is the epicenter, but also Salvador was quite affected as well. Emergency call 2016, and then it was an important time. A democratic government that managed to add other government institutions, funding agencies, universities, research institutions, scientific associations, and civil society in a nationwide mobilization. That was very important, and this is absolutely fundamental in the history of Brazilian public health, and Zika shows it. You know, it will happen. It happens very differently. For instance, when we had an even bigger epidemic, which was actually a pandemic of COVID-19. And in 2016, a group of researchers and managers such as Gadelha from Fiocruz and other Fiocruz co-workers such as Pedro Vasconcelos from Belém, we wrote an article that summarized a series of discussions that were taking place, and it meant a scientific agenda to Zika virus, and also motivating trying to summarize actually the several research lines that were being developed and try to organize that. The article was published in March 2016, very early when we started studying the epidemic. And here I will not repeat what has already been mentioned by Selena. You know, researches and surveys done in our country, especially in Recife. There were several papers produced, and this paper, led by Natalia Velho, shows the relationship between the virus and Zika syndrome. It was a viral infection, and it brought down a series of theories and hypotheses that appeared, and it did it very clearly. Zika platform emerges at CIDACS. It was when we were actually building CIDACS. It would be inaugurated late 2016, but we already had the initial and fundamental concepts to create it. And our colleagues from Brasilia, especially Wagner, who will be talking here, as well as Yuri, Betania, and other colleagues from the Federal University of Bahia, Gloria Teixeira, and others from Fiocruz, Rio de Janeiro. So we set up a large group with the support of the ministry, and Agenor played a very important role in it. So we wrote down an MOU in April 2016. Things went very fast at first. So we had a nationwide mobilization, and everything was done very quickly and in a very agile manner. And that was very important in the um, development of the disease. So it connects to CIDACS and CIDACS projects to integrate a nationwide base for the production of knowledge. The idea was to apply these ideas to Zika. However, platform was more than that. It included several components because it was a complex project. It included epidemiology issues, also research prospections, collaboration networks, and production. Um, all these issues about data security, and we also developed the concept of open science. It was a very important time for this particular development. The epidemiological part of it, I mean, I'm sure that Annie will show you some results tomorrow, so I'm not going to dive into the details, but other colleagues such as Betania and Wagner would certainly or will certainly approach other components of what we call Zika platform. But I would still like to approach some of the things that were discussed here around the Zika science. One of the objectives of the platform was to study the development of this disease. This article was published in 2018. I think it was 2018. This is quite interesting because it shows the leadership of Brazil. Here you see the scientific production on Zika throughout this period until about 2018. Study was published shortly after that, and Brazil plays an important role. Not as important as the US, because the US really plays a very important role, but Brazil has also an important role that is linked to the epidemic that was going on in Brazil and the reaction of the scientific community. And also, Brazil takes part in several scientific centers where we can add with our own Zika research, and we also collaborate with the several different countries. Here you see the vectors of collaboration they created either through Brazil or straight from it. But Brazil it plays an important leadership role in these scientific collaboration efforts. Brazil also participates in many of these areas, but you can see something else that is also quite important. Brazil, has an important leadership in initial clinical epidemiological studies, but bit by bit it loses its leadership role to certain scientific areas that is not to be transferred to other countries. So someone mentioned, I think it was Wilder who mentioned that it took a long time for funds to be transferred, the difficulty of keeping long-term projects, and it impacts on the long-term development of knowledge. So we missed an opportunity to close this cycle and lead all phases in scientific production cycles that are somehow transferred to other laboratories elsewhere. And it adds to the international sharing of knowledge. To give you an idea, last year, early this year, Lancet of Infectious Disease, one of the most important journals in terms of communicable diseases, published a series on Zika virus, which is absurd because it absolutely disregards, first, with very little participation of very special individuals in the knowledge development. They would have to contribute. They would have to be invited to contribute. And more than that, they disregard some fundamental things. It doesn't even mention the congenital Zika syndrome. And our group then reacted to it by reciting all of our nationwide production and merge, for instance, production that were important to set up initial knowledge. And it was just forgotten or disregarded at the time that such an important magazine launched a series. This is our communication to the Lancet Infectious Disease. It was published, it was led by Betania with the participation of Laura, also an important agent in the development of knowledge around Zika. And we tried to show the position of our group as Brazilian researchers, about this historical era, or perhaps it's a discriminatory act, as they produced something about a problem that Brazil was the epicenter. Brazil was very important. Brazil played an important role, but at the time of producing a summary of the knowledge, Brazil is disregarded. So I wanted to call your attention to this, how this scientific development process is complex. On one hand, we missed opportunities, but on the other hand, the international community many times discriminates or disregards our efforts. Some other products of Zika studies are written in several articles. I mentioned one, but there is a series of other articles, particularly about the epidemiology of the disease, and which Annie will certainly present tomorrow. But there was also a book launched. This is available for download on CIDACS website, summarizing what was done with the platform up to 2022. The book was launched in 2023. The book had the participation of several individuals. This is a joint production. Here we had the participation of dozens of individuals have collaborated to it, so it is very important to register it. Under the standpoint of the epidemiological research, it was a great opportunity, and it was added to what we had been developing at CIDACS, or the development of CIDACS cohorts. One of these cohorts is the 100 million Brazilian cohorts. Today, it adds up to 140 million Brazilians, actually 143 million Brazilians cohorts, and it was essentially built with diverse public registries, from the single registry to Bolsa Família, family allowance program, and CISV, SINAS, CISVAN, SIH, coupled in an integrated data structure and developing a longitudinal way. This cohort is being applied to several objectives, including Zika studies. But in parallel to 100 million Brazilian cohorts, also the cohorts of births in CIDACS, about 30 million births is what we have now. So these are important elements that allow us to study things, to see things more comprehensively. This is not similar to primary data cohorts. It occupies a different space in the scientific process, but we understand that it adds to the nationwide scientific production efforts. And in the particular case of Zika, it involved the linkage of several databases from CIDACS, SINAMS, RESP, BTC. After a few years of discussion, we managed to bring BPC to CIDACS. We have a specific situation of BPC also to link data, and it will certainly leverage the potential of ours to research other diseases, impairing diseases that are linked to BTC. And the existence of this database will certainly expand our research line through successive linkages. To give you an idea, in 2018, we already had 3,300 cases of congenital Zika syndrome confirmed, probable, added to this platform. And as you will see tomorrow in further details, it is allowing a series of surveys and understanding of what is going on and the problems affecting the population. And what's going on with the population, then this will be mentioned tomorrow in further details. Here, I summarize some topics that were mentioned by Gloria. I will certainly not talk about it as well as Gloria would, but she asked me to convey this to you. With this data, I mean, there were studies on the journey of the Zika virus dissemination and emergence. But by using genomic techniques, we managed to understand the introduction of Zika virus to Brazil. The thesis here is that Zika enters Brazil in 2013, before the appearance of first cases. The genomic methods allowed us to detect that, allowed us to better understand when the virus actually entered Brazil. We also demonstrated that dengue disregarded cases were actually Zika virus cases. This is important, and we have some studies published on it. That was a study because there was a lot of confusion about both diseases and diagnoses, Zika and dengue. So we tried to cope with that using statistic data to show this overlapping and contamination of cases of one disease being described as another, especially in this early phase, which created a part of a problem and initial confusion on the diagnosis. It also supports the recording of abnormality at birth. There was a review of the problem because there would have to be an effort to detect Zika-linked abnormality, but it also served to improve the abnormality at birth identification in general. It also showed that more vulnerable women were more susceptible to being infected by Zika. So Zika is a problem that reflects Brazilian inequalities. Okay, so it shows that children with congenital Zika syndrome have a 12 times higher risk of dying than children without the congenital syndrome. So the mortality between 2015 and 2017 was of about 10%. Here I am only mentioning a few figures. The risk of children with the congenital syndrome dying was 30 times higher for respiratory diseases and 57 times higher than the nervous system diseases. You see the suffering and the dying standards that we could understand in those children and the main causes that lead to the death of those children. Uh, uh, Congenital syndrome children have much higher rates of hospital admissions, and maternal infections by Zika were associated to several adverse effects, particularly congenital abnormalities, with a 2.4 higher risk compared to the non-exposed groups. And from this, we have a series of recommendations, which I will mention briefly. The knowledge accumulated here, together with other nationwide efforts, I mean, they reinforce recommendations for care and prevention of future epidemics. Warning and guiding healthcare teams on the causes associated to children's death, protocols for more severe problems, establishing post-neonatal protocols, well-established ones, permanently reinforce individual protection measures, particularly to pregnant women, is strengthening and improving the control of vectors, aiming to prevent microcephaly cases, is strengthening capacity building processes of healthcare professionals, improving the definition of Zika and dengue cases, as well as strengthening processes that would allow us to understand the infectious diseases. I will not keep going with her slides because I believe my time is nearly over, but I'd like to mention that this is gone, so I've two slides is too ice. I mean, never mind. That's what I meant to say. But once again, I'd like to tell you how the Brazilian public health care system was important despite government activities during the COVID pandemic. The existence of SUS was very important to give the society some level of response and Zika or every effort that we made shows how complex the problem is. It also raises identify chronic problems in the Brazilian society. The issue of arboviruses is a very complex problem that must be faced, and then I mention it again. It's not a problem of the Ministry of Health, it's a problem of the Brazilian society, of the Brazilian government to face this problem. And on the other hand, it shows the existence of Brazilian public health care system is absolutely vital for us to have a proper capacity to respond to such a severe issue. Thank you, Professor Mauricio. Your talk was very, very important. And the complexity you mentioned, of the scientific process is very important. There are questions, but I will leave it to the end. And also contributions from the platform itself. How important it is to develop the studies on Zika. Now I will give the floor to Dr. Betânia Almeida for her remarks. We gave Professor Mauricio a little bit more time because he gave not only his talk, but Dr. Maria Gloria's as well. Thank you, Rita. Can you see my slides here? Yes, we can. Although it's not yet in a presentation mode. Okay, thank you. Professor Mauricio has already mentioned a few topics that I'm going to briefly comment on, but my research, my presentation is more about the data available at the Zika platform, data for research. I will stop sharing and share it again because I'm not being able to pass slides forward.
Screen. Deixa eu apresentar pela... Acho que agora vai. Conseguem ver?
Ainda está na espera. Agora vai.
Obrigada.
Yes, now.
O professor Maurício já falou da plataforma.
So, Professor Mauricio mentioned the Zika platform in its initial phase, and it was published in 2022. We report papers up to that particular time. This book tells this story, and it is available for download at the CIDACS, and we have chapters devoted to that, to those specific areas, such as there's a chapter on open science and data for research. We already mentioned settings and challenges and opportunities. The group devoted to this included myself, Alexandre Rodrigues, Marcia Luz da Mota, Fiocruz Brasília, both them, Paulo Xavier dos Santos, who used to be a coordinator of Fiocruz and coordinated this work group, and Vanessa Arruda, who's currently coordinator for education, information, and communication at Fiocruz. We started to discuss research data, open science prospects, and we map out this topic. And we realize first that every discussion on open science aimed to give access, to share, to use and reuse research data and data for research were much focused on data produced by research projects. But then we started to discuss the specificities, and we understand that Zika platform is different because we use secondary data that were generated with other aims, and they must be turned into data for research. We use data from social protection and healthcare information, and we integrate the data to put together our cohorts, such as the birth cohorts and 100 million Brazilian cohorts. And we mention here potentialities and challenges. Among the potentialities, longitudinal studies and very specific populations, because these are not samples. These are data that represent groups that interact with the government. And then we have the nationwide health systems data from actual people, interacting with the Brazilian healthcare system. But there are several challenges. We have to put together computer infrastructure, having a head count devoted to data processing. We call it NPG. We also have a curators center. When we don't know when the data is collected, we don't know where it comes from. Just when it comes to CIDACS, we have to ensure security and integration. Data integration requires individualized data. These are personal, sensitive data. We do not have consent forms, so we need to negotiate case by case, each case with the department, with the secretariat, with the ministry, specifically Ministry of Health and Ministry of Social Development and Fight Against Hunger. So we have several challenges that are inherent to the Zika platform. During this first phase, since it is a longitudinal platform, and new researchers, young researchers must join the platforms because we will eventually pass away, and we needed to continue. So we discuss open science here. Open science is a very dynamic movement that starts with opening access to knowledge and then data, and then other issues are also included. But because it is dynamic, there are several interests and several issues. But here we're talking about data used, not only primary research data, but also data from several different sources, data for sciences, for studies. So these were some activities that we have held. or images of it. This work, coordinated by Xavier, who's now DataSUS director, it drove the development of the research for data sharing at Fiocruz. And then we started to discuss other issues related to sharing data among the scientific community. And we observed that initially the World Health Organization requires funders, journals, editors, and the whole scientific community to share the data as fast as possible, to publish their findings. And then there's this issue of fast track, and many funders as well. Many will agree, and they started to request that this data is placed in specific repositories. I will not get into further details, but there is also a leverage in the discussion about this helicopter or parachute research replicating inequalities, but understanding that countries affected, in this particular case Brazil, will be seen only as data exporting fields, without considering, as it was mentioned by Dr. Turki and Barrito, the knowledge and expertise and experience. I mean, from this discussion, we started to think about terms and conditions to open sharing and accessing data in order to answer questions, generate evidences, notably in times of public health emergencies, epidemics, or pandemics. Professor Mauricio has mentioned this article. It was published in 2020, but it studied between 2015 and 2018. This article already brings different analyses that were mentioned by Professor Mauricio on the production of knowledge and the engagement of countries in search for answers. It approaches several countries that published on Zika virus, the 10 main ones, and we realized that US, France, Germany, England, and Brazil were the countries with the largest number of international collaborations. Between 15 and 16, knowledge production was more concentrated in areas related to clinical and epidemiological elements. But then starting in 2017, we have increased knowledge production in molecular and biology knowledge meant for the development of vaccines and treatments and a series of other things. We know that technology and scientific capacity are unequal. Access to data may even be standardized, similar access, but whoever takes hold of it, will determine differences in the production. So in case you want to read it, you can access it, you will realize it. Another issue, I'm not sure now it stopped share, no, not sharing, but passing. No, yes. This is the letter or the communication we forwarded to the Lancet Infectious Disease on this series. This series is entitled Advancing a Priority Research Agenda for Preparedness and Response. And then there's a series of articles here in this series. And as we read the different papers, as we read it, we decided to put together this communication. It was interesting because when we forward the communication, the editor replies on the same day, and we forward them the material. And as a reply, they say we may publish, but that should be up to 5 authors, 5 references, 700 words. But we did our homework. We tried to summarize our issues. This is a print on the left-hand side of the article. You have the print and then a larger print of a stretch that I would like to highlight. Here we talk about the striking authorship disparity in poor representation from affected countries in this series show a persistent trend since the onset of Zika epidemic. The series fails to recognize the research teams, particularly those studies studying this condition since 2015, and keep on studying the long-term effects. And we also reinforce that this imbalance shapes a research agenda that prioritizes technological advancements in diagnosis, therapeutics, and vaccines, while excluding epidemiological, social science, and participatory research, which we regard as very important to respond to public health emergency. When people go after the series, our letter is mentioned down here. We were very happy with that, and you know, it was very important to position. They asked for 5 authors. It was a constraint imposed by the journal, but we listed all members in the group, including the Unizika and other groups that are participating. And tomorrow they will be here talking about their own papers. Getting back to open science, and then I told you it is an ongoing dynamic movement with many interests involved. UNESCO in 2021 launches this open science recommendation in June last year. No, I'm sorry, this year. It was this year. This year in June, UNESCO launched a guide on data policies for times of crisis facilitated by open science. And they understand by times of crisis not only health emergencies, but also natural disasters, geopolitical crises, but crises that affect individuals and drive humanitarian issues. I find interesting to see how things unfold. Now we have guidance and principle for data policies in times of crisis. These recommendations point out very interesting challenges, some of which we already face at CIDACS on infrastructure, on data standardization, interoperability, among other specific topics. Here I try to compile it all for you to realize that here, for instance, here we have data policy requirements and the role of data policy in terms of preparedness, response, and recovery. And they rank or they list all topics based on each specific challenge. If you're interested, that could be a very interesting reading. On the other hand, I also bring some questions because no matter the international recommendations, there are asymmetries between countries, researchers, institutions in order to implement the recommendations. And once again, data access, of course, that in times of a public emergency, public health emergency crisis, we have to be quick. Professor Salinas says that research is part of the response. We agree. There is a cooperation among different actors, but how does it take place? We cannot believe that fast answers will solve the thing. At the same time, we must put together infrastructure or means for the sharing to take place quickly. That data is minimally standardized so that people will be able to interpret. And it also comments on other aspects such as public communications, transparency, and also here we mentioned the need for capacity building. And then both the Professor Ajanors and other, we need to invest always. We need to devote resources. I mean, we have the will, we can say this priority, but priorities we realize when there are resources and individuals to respond to challenges. This group, a 3-people party devoted to developing data at the Zika platform. It's Mariana, Adriele, and myself. We have backgrounds in collective health and social work. I mean, we have a very pragmatic view, but you need to understand how knowledge is built and what there is so that we can get together and go after defending what we do and how knowledge can be applied, because not necessarily policies will be based on evidence, but that's what we try to do as much. You are running out of time. I have 2 minutes. So we have a study in progress with is a scope review on public emergency use and reuse of data focused on Zika virus. We have already registered, we we use Providence to share and carry out analysis. This is a study in progress. There's another one who's somewhat more complex, but which also tries to review and summarize literature under the more theoretical standpoint to expand the sharing of data. And at last, what we expected these studies to be good for. Position knowledge production. Who are interested? Who are the stakeholders? What are the settings? What are the requirements? What are the interests involved? In the case of the Zika epidemic in Brazil, for us to carry out not only nationally but internationally an empirical research. We expected to complete it in 2023 and start a field visit with surveys, interviews, focal groups, funders, managers, stakeholders, affected populations. We are still conceiving this to go to field. In my final remarks, the use of integrated administrative data to the Zika platform allowed a new area of knowledge to emerge. We call it the data governance, science, and society. And our goal is to assess the access and sharing of data in public and health emergencies with the aim of research. And here we're talking about scientific community in a very comprehensive way, considering sanitary, political, social, and ethical aspects, nationally and internationally. That would be it. Thank you. Thank you, Betania. It was very interesting to have your view on access to science, democratization, and the issue the colonialist taking hold of. I'm sorry. Some people are upset with this Lancet appropriation of knowledge, but I will give the floor immediately to Professor Wilson. Actually, Professor Wagner. Sorry, I'm sorry. Professor Wagner, yes. Wagner Martins from Fiocruz, Brasília. Thank you, Professor. I'm sorry for the mistake. No problem, it happens. I will establish a chat on cooperation approach so that we can improve our performance in congenital Zika syndrome surveillance. That was something we thought about attracting the health productive sector individuals. We held a planning workshop, and as we discussed the different possibilities, we got to the idea of holding a fair of solutions to health. This idea, today we see it. I brought these extracts from Professor Feuri, Sonia Feuri. She addresses COVID-19, but she mentions elements that call our attention, such as the need to mobilize the society. So what the community can do to meet their requirements in times such as those of the Zika-driven and COVID-driven crisis. Of course, COVID called our attention even much more, but at those times, with our fair of solutions, we already realized it, and there were strong tips that the society was already offering response with social approaches that would meet the requirements the government did not. So here we are talking about the possibility of an open science engaging communities in the in a popular surveillance process that will also support long-term surveillance. So we had the experience of treating this project from different standpoints, such as the epidemiological standpoint with the cohort, production of research on treatments, information protocols, database, but also this element of network connection, in the search for solutions that are in the industrial field, the social field, that and also in services. And this model ended up becoming an innovative proposal because we managed to create rooms, to create fora of discussions, uh, uh, from mapping situations, and solutions. And the process we presented and networked elements in these collaborative workshops, and then using this larger network and technologies for the development of an important database. So this model uh, was consecrated inside Fiocruz. We are already at the sixth edition. We have already held fairs or exhibits in 5 different regions of the country with more than 7,500 participants. Today we have a solutions bank with 400 plus solutions, 800 partner institutions, 300 different activities were already held, and these activities, they have an important impact on the acknowledgement of local realities. The movements started these fairs or exhibits also leverage our capability to understand how the different social actors, be those communities or companies or actors or services, when well mobilized, may lead to joint actions, joint activities that speed up the process of solution finding. So this exhibit or fair approach allowed us to work different topics, starting from Zika to the digital solutions fair or digital solutions exhibits that was held here in Brasilia a couple of years ago. And we had the introduction of a series of technologies, expert capacity building programs where students brought their program completion papers to be presented and technologies to be developed. And those were very important for us to advance in the creation of approaches and innovative approaches. And this other platform is cooperative intelligence with a primary curve focus. We call it a PCAPs. It was created before, but it was improved in these fairs. This is a strategy to integrate primary care and surveillance in the territories to face sanitary crisis. In these platforms, digital health, territorial action, and even capacity building and professional training and epidemiological intelligence get together so that solutions are fully integrated. And therefore, we today are capable of expanding this model throughout the country. Here we have co-labs that are being created with the participation of universities, signing agreements with the Fiocruz to establish themselves as local co-labs, and technical social approaches are also being implemented in the territories in order to drive the creation of social solutions that can serve as basis to promote health, as basis for popular health surveillance, hence strengthening epidemiological surveillance to constitute a large network of sustainable health territories. So the fair model shifted paradigms as it turned the affected population into active actors of programs, establishing a dialogue with the sciences, society, and health services. This is uh, wonderful. I mean, we didn't have much initiative, uh, such initiatives, but the fair allowed us to have science leading the dialogue between society, government, and this model was established as a new paradigm for the Brazilian healthcare system. I believe I managed to deliver my talk um, in less than 10 minutes. And once again, I want to thank the opportunity to talk about this experience and to sharing this webinar with such important colleagues, although running and trying to be as fast as I can, but I believe it would be important for us to understand and be able to face future solutions and future crises, be it COVID or any other, provided that we have this platform working throughout Brazil so that we can have the actual reality data being considered together with the CIDACS data banks. So the idea is to really set up a large network of epidemiological network. Thank you. Thank you, Wagner. Yes, that was another very important aspect of open science. Popular participation is very important. We didn't hear much today, but I think it is also very important to have this population playing their leading role as well. We only have one question, and then I will also ask questions, but Eliza says some studies point out to a possible larger impact of Zika because there might be a larger number of children who were not necessarily diagnosed with the congenital Zika syndrome, but it may lead to developmental delay and sequels. Some may also appear later, and they warn us for the need of long-term monitoring and follow-up. Is there any specific data on it. And she apologizes she didn't read your book yet, Betania. The need for long-term monitoring. That's what she's asking. Anybody would like to answer, Betania? I think so, Rita. Elisa. Hello, Elisa. Elisa is in the US. She is speaking from there. But Elisa, say yes. And he will speak tomorrow. I hope you are here tomorrow at the same time, and then we can have a clear discussion on it. She may bring further details. I'm not sure Ani is still here, but never mind. We are trying to do the linkage of infections during pregnancy. I mean, it's Zika infection. I mean, mothers who were infected with the Zika virus. And we have a certain number of mothers who were infected by virus during the pregnancy. It was a significant number of mothers, and the child wasn't born with a congenital Zika syndrome. Yes, we do have that as well. Those children are taking part in some studies at CIDACS, because although they were not born, although they were not infected, or I mean, no, the infection didn't lead to the same problems. Most infectious illnesses have a similar spectrum, such as children with a visible abnormality, some won't even survive, and those who are born with problems that I believe emerge folks know it quite well, and it will show up, in their lives eventually. We do consider those as well, and it's important for us to understand the history of the disease, because the history of the disease is linked to having infection cases that didn't end up in a severe form. And he will certainly mention some of the results of her study. Thank you, Professor. I'd like to ask you a question, Professor. You mentioned some areas of knowledge around Zika and the leading role or the leadership displayed abroad. But what would be the strategy to rescue the leadership role in areas that are now abroad? Look, that's very difficult. Perhaps Agenor could comment on it. Others such as Wagner, Betania, Wilder, if he's still here, because he's from the Pan American Health Organization. This is an issue of positioning ourselves. I mean, and measuring our scientific life. I mean, we have made important progress. Today, we have a reasonably well-positioned scientific community in several areas of knowledge, but no doubt we're still missing resources and investment, so the laboratories, research, and research groups can, undertake long-term commitments and ensure that you will meet those commitments. And also, the level of funding in Brazil is quite irregular. There are very bad times, some better times. Currently, we are experiencing better times, but even though it's not enough, if the country wants to undertake or expand its leadership in the scientific arena, and I'm not only talking about Zika, I'm talking about the science in general and the scientific leadership which is necessary for the creation of groups, communities, networks that are solid, funding, resources, equipment, personal. At CIDACS, for instance, we need more computer power. We need skilled professionals to move it all forwards, data curators, information security folks. I mean, it's such a complex of things, and to keep a research structure that requires important funds, and of course the possibility of developing this in the medium and long term. It doesn't happen miraculously. So these are strategic political decisions that a country makes, given the different priorities of the country. We have to fight against hunger, we have to fight against poverty, we have to structure our health care system, and we have to think about a science and technology system that will allow us to place ourselves higher up in the international settings. It implies that political decisions, institutional rearrangements. Universities are still, Brazilian universities are still very vulnerable. You know, the level of bureaucracy and resources management. You know, this is an issue. If you are working in any research institution or public university, by public I mean state-owned universities, you know, face it daily. There are some issues. You know, there is a legislation. It doesn't solve the problems though, but the problem really is political will and expanding funding opportunities in order to create or expand and such as in a situation as a Zika epidemic. I mean, Brazil still plays an important leadership role. The American scientific production is much greater than that of Brazil, but because they have much more resources, more laboratories, more people devoted to research, and they are capable to quickly mobilize funding. Although the problem was not observed in the American territory, but in the Brazilian territory. So it's up for discussion, and this is not a discussion that will end up here. You know, it is a discussion that the scientific community in Brazil is holding. Ministry of Science Technology, SBPC, and scientific communities all over the country. I believe we are improving, and this seems to be promising now, but it requires medium and long term strategies and avoiding mistakes such as the creation of this P4 laboratory, which should be in the Ministry of Health, but it is elsewhere. So these are mistakes made by the country, and we should not be making. I will give the floor back to Betânia Almeida to close the panel.
Em relação ao professor Maurício falou, concordo plenamente. E acho importante.
Professor Maurício mentioned training and capacity building. It is important that you take part in this meeting tomorrow because we will discuss this even further. I'd like to thank you all for your participation on this first day of seminar. Tomorrow we will start tomorrow. We will only have one panel tomorrow, so we will have more time to discuss cohort studies on congenital Zika syndrome, the potentialities and challenges of the Zika platforms, but also other three cohorts. It is important that you participate in discussions as well as a project. You can follow our communication channels, our social media, and our website. So I wish you all a very wonderful afternoon. Thank you so much. Thank you very much, everybody. It was a great pleasure to see you all here. Wagner, Agenor, I didn't see you very much. It was wonderful to see you all here. Thank you so much. Thank you. Bye.
Recording stop.